Hi guys, I wanted to do another update on Kaitlyn's migraine journey. Before I start, my dog is like laying right here, so if the camera wiggles or something, he's just enjoying the sunshine beside me in the window. But the last time I gave y'all an update, we had gone to see an ENT and they had told her she had 80% blockage and just was not breathing great through her nose. So she did end up having that surgery done. Unfortunately, we had her tongue tie released on Monday before Thanksgiving. If you want to know about that journey, you can go back and look on that. And then just the way it worked out with her school schedule and being off, we ended up having her deviated septum correction on the Thursday following. So Monday, and then we went a week, and then the Thursday she had her deviated septum surgery done. You can see pictures of her that I posted after that. The doctor who did her surgery is amazing. He does things a little different, and you couldn't even tell she had it done. There was no swelling, there was no bruising or anything. She had it done Thursday. By Friday night, she was at a concert at a local college here, and the next night she was at a basketball game at the college here. So it really was amazing. And if you want more information on that guy, contact me and I'll give you his information. He's in the Kansas City area, but he just does things different and he's very good. But she did have like a bad headache afterwards because she had stents in her nose and just the pressure. But as soon as they took them out, like the following week, she could breathe through her nose and just felt wonderful. And she was excited she could taste again because that was gone when she had the stents. So since then, I haven't given y'all an update for a while on her because it was one of those things when you've just been hit too hard with too much at one time, you just need a break from it. And she was definitely needing a break. We had to take a break from the myofunctional therapy just to give her time to recover from the surgery, but also just emotionally and mentally. She's been needing a break from everything. And so we've done that. We've backed off. Since then, she has been able to start just a little bit of the myofunctional therapy, and we'll get back on board on that. But I have just given her some space there and given her time to recover. I will say, if you have someone that you know, like a child especially, who has chronic pain, sometimes it's good, or a lot of times it's good, not to bring it up all the time. I know as parents, especially for me and trying to treat her, I want to ask, how are you doing? How are you doing? How are you feeling? Just especially part of it is I want to know if this is working. But there are times where she just needs breaks. And she had told me after the surgery and everything, she's like, I just need you to be mom. And that's totally legit. That's the hard dynamic of being her, just her advocate in a sense for the pain and pursuing all these different avenues, and now as her myofunctional therapist, and then also being her mom. So that's another reason why I've backed off and just let her just kind of chill with everything. Also, after the surgery and everything, her blood pressure had kind of increased, and I think it was just all the stress, and it can be from dehydration. But she's just needing time to recover from all of that. I will say she is saying she's breathing so much better through her nose, and she's feeling a lot better with that. And as a side note, she is enjoying life. She's working at kind of a basketball camp kind of a thing. She's thoroughly enjoying it. She's right now, I was going to ask her just so I could do this update and tell y'all where she was at in the pain level, but she's like, oh, I'm kind of busy right now, and she sent me a picture. They're sledding. So she's definitely active and definitely just pressing on with life. I do know somebody had asked her recently, how she was doing, and she said better. And I do plan on talking to her for sure. I know more than likely, the pain isn't totally gone, and I'll get with that in just a second, or to talk about that. But in general, she's pressing on. We're not there yet. We're not at the total relief of the pain every day, but we are making progress. It's one of those things where we started out and we had no answers. We had seen all these people for her chronic headaches. She's tried all the medicines and nothing was working, but we are just taking off the boxes one by one. In the past, I've talked about the carousel of all the causes for pain, and we're just trying to knock those out one by one. One thing I have learned, and this is for everybody with chronic, especially chronic pain, and a lot of times it can be tension headaches, TMJ issues, and chronic pain, that a big part of the pain, from all my research and then speaking to a doctor that a dentist I actually used to work for, who would treat this 20-something years ago. It's like, oh, I didn't ever make that connection, but I didn't recognize that it was the headaches were such a real thing. But there are two factors that can cause the chronic headaches constant, like here and here, is the two things are bruxism. Bruxism means just clenching and grinding. And the other thing is when our teeth are off and the occlusion is off. And I've got pictures of teeth here. So these are actually my teeth, a model of my teeth. I need to kind of grind them down. But I don't know if you can tell that it's kind of not straight. You can tell that one's kind of over and that one's not. But if I push this down a little bit, it kind of lines up. Whenever we bite down all the way, it can be out of balance like that. And I don't have pain. I definitely have popping in my jaw, but I don't have pain, and I'll get to that in a second. But if I were the type of person, I've talked about this, where you can have a person who feels things a little deeper or is going through a lot in their life, or even just has sleep apnea. All those things, or an airway issue, all those things can cause just clenching all the time. And just high stress, clenching at night from sleep apnea can cause that clenching. Well, when you're clenching like this, we have muscles right here. It's called our masseter muscle. It's a big one. And those go up and affect our temporalis muscles, and then affects this. It also affects muscles in our neck, because if you just, and you just clenching like that, you see all these muscles. And then we have muscles on the side here that causes our jaws to go side to side and back and forth. And so when we're clenching, we're just firing all these muscles that are not made to be fired all the time. I know for me, just doing hygiene, and if you're a hygienist, you can totally relate to this, but I am using the suction and I'm pulling cheeks back all day, just constantly pulling those cheeks back. And now my wrist is starting to bother me because I'm doing the same motion over and over and over, and it's harder, especially for those of you who have tight cheeks or have these issues. These muscles are really tight, and I'm fighting against that. And so the constant motion on that muscle is starting to cause pain here. Well, the same thing with our muscles here. Whenever we're constantly clenching and biting down, our muscles aren't made to do that, and it's too much, and it's firing them too much. But it's especially worse when our bite is out of balance. When that bite is out of balance, then one muscle might be a little more over this way, just like when I showed you this, when it seemed like it was a little out of balance. Let me fit these teeth together. Yeah, out of balance. Ooh, that's really bad. Then one side is affecting the other side. So to balance it out, then one is having to pull a side on the muscle down a little more. So our muscles are just helter-skelter, just in there firing the way they're not supposed to. That then, just like I said, it fires everything. So there are different things to do to try to release that. We've got to take away one or two or both of the problems. So bruxism, or clenching and grinding, and then occlusion, or bite that's out of balance. So you can either try to stop clenching and grinding, and that can be if you're doing that at night while you're sleeping. That can be from an airway issue. You could get that tested, try and get that checked out. And sometimes several of these things are factors. It can be if you just have a stressful life all the time. Try to do things to not be stressed all the time, and try to make a conscious effort to relax all these muscles. It could be that your teeth are it might need to make sure they're as balanced as they can be. One of the things that I have seen in a patient that I've been dealing with who has had a lot of pain, and Kaitlyn got one of these too after she got her tongue tie released, the dentist gave her a splint, just a temporary splint to go right in the front of the teeth. I have heard those are old school, but it has worked for one patient. Kaitlyn has not had a chance to try it yet because, again, she's been trying to just step back and recover emotionally, mentally from this. But what it does is when you bite up here, then your teeth back here can't bite down, and it deprograms these muscles. And when these are deprogrammed, then it starts allowing them to totally relax. And because they've been constant year after year after year, just tight, firing. And so it allows those just to deprogram and totally relax and heal in a sense. And that can start taking away the headaches. That's just a temporary on that. They can make an orthotic device, and this is what we're considering with Kaitlyn, and I do feel like this would take care of it. I just want to see if we can, before she has to wear a device every single night. That's what the myofunctional therapy can help with too. But the orthotic device is specifically designed for your teeth to balance your muscles And when you can put it in, some people have to start out all day and all night to deprogram these and get them just totally relaxed, and then can transition to night only, because that's when they tend to can clench. And you can put that in, and then when you do bite down, all these muscles are totally balanced. You still have the issue of biting down. You want to try to, again, just find the root cause of that and try to eliminate that root cause. So we are considering that with Kaitlyn. But the myofunctional therapy, the whole purpose of that is to retrain all these muscles to function. That's what myo is, muscle function. So to retrain the function of the muscles to do how they're supposed to do, which should relax these. So even just nasal breathing, that's one of the key factors for myofunctional therapy. It can calm the body. That in and of itself can calm the body, which can kind of help relax this. But even having the tongue up and just focused on the teeth not together all the time, that's part of the therapy. That goes hand in hand with just relaxing all these muscles. I have seen, and this was with Kaitlyn, but somebody who was so fired in this that they couldn't do the exercises for myofunctional therapy because they were too fired. So we had to deprogram those muscles and get those rested, so then we can start from the beginning and get these functioning the way they're supposed to function. So I'm hoping to pick back up with Kaitlyn. We'll see if I do the therapy. I might have somebody else step in and take that so that I don't have to be the mom and the therapist for her sake. And if she'll get some help with that. Otherwise, we will potentially put her in an orthotic device that will help just deprogram all this. The reason why I know she needs one of those is when they've done the 3D scan, there have been 2 doctors that have commented on her condyle, which is when you have your mandible and there's kind of 2 bones that go like this. The one in the back on one side is totally messed up, just from years and years of having her clenching and just warping that bone, which a lot of people have that issue. If you're clenching a lot, that can be an issue. Another thing that can be done is seeing a person who works with fascia. And I've talked about fascia in the past. It's like connective tissue all in your body, and it tends to tighten up whenever there's a sense of danger. It'll do that to kind of protect you. And if I've known people, if you've had like an accident, a car accident or something in your life that has just kind of been a lot of trauma, even physically, then that fascia can be all out of whack in different parts of your body. And there are people who specialize in releasing that and getting everything relaxed in the way it's supposed to go. There's something called craniosacral therapy, and they specifically work in this, and I've seen it even done on babies. It's amazing what that can do for babies, and just while they're nursing and different things that are just tight. It's pretty cool. But for people who have had, everything out of whack or something, or have had a really stressful life or trauma or a physical traumatic event, having that therapy done can help just relax all this fascia as well. So it could be that could even take the place of the splint. So I'm investigating into that. I have found someone for Kaitlyn to go see, and I've recommended her. She's not in this town, she's in another town, so I found a provider there. And again, if you want to know about one of those, contact me. You can just message me on here or go get my information on my website, and I will try to find a release provider for you. But they can just kind of help release that fascia so that it can relax, so that everything can function the way it's supposed to function. But then again, we need to get to the root of what's triggering that. And it could have been a past event, but it could be also current with the clenching and the teeth being out of balance. So I'll keep you posted with Kaitlyn where we're at. This is where we are. She is, she's better than where she was. We have a plan. And I do believe just if the myofunctional therapy, if it's done well and done thoroughly, which again, it's hard for her to do with me being mom, then that in and of itself could just take away the tension and the occlusion and the firing of this, because that's exactly what's going on with her. But if not, then we will get an orthotic device that will help her in the night. And I am fully convinced that that is the last thing that can be done, or that to take the headaches away. So if you have any questions or anything, feel free to comment or reach out to me. And if you have any questions on anything or would like a video on something specifically, don't hesitate. I'm not posting as much as I was thinking I would, or videos, because there's so much to learn. I'm taking it all in and I am learning a lot, and it's been very encouraging. I'm also seeing patients now with myofunctional therapy, and that is growing more and more because the need is real. But don't hesitate to reach out. Thanks.